All right, oxygen is the most important ingredient in the human body, and everybody's low in it in certain areas. And so we have therapies that adjust that for you and help to replenish oxygen. Today, we're going to talk to you about LiveO2, where it goes back and forth between high and low dosages of oxygen to get oxygen to cells. I think you're going to love this podcast. Stay tuned.
Hi, everybody. It's Cameron again. I'm here with Dr. Chris Cormier. Today, we're going to be talking about LiveO2, which is an oxygen modality that you have at your clinic. So let's talk about it. LiveO2 uses something called adaptive contrast. What first drew you to this approach?
So I love, obviously, oxygen because it's our number one ingredient. And so when you think about the human body, we should be 65% oxygen gas.
Yes.
That's why we can do without a ton of things. You can do without drinking. You can do without eating. You cannot do without breathing. Don't try it, right?
Yeah.
The problem is nobody breathes enough. We shallow breathe and we don't know what we're breathing anymore. So over time, this body starts to lose that oxygenation and it gets all kinds of cells sick. So from our standpoint, we have all kinds of oxygen devices that help get oxygen to cells. The reason I fell in love with LiveO2 is because LiveO2 is a therapy that actually causes a demand for oxygen. So it floods the system with oxygen and then it starves it a little bit and it floods it and starves it and it creates this demand. Wow. It actually creates something called vasodilation, which is opening of the blood vessels so that the oxygen can uptake quicker.
Amazing. How long have you been using LiveO2 in your clinic?
It's been a few years.
Good. Good.
Yep.
So let's continue on with Oxygen Week. Why is contrast, which is high plus low oxygen, so powerful in the human body?
So again, as we are breathing right now, this is about 21% oxygen, just for reference for everybody. So we have a device and it makes you breathe around 90% oxygen from a tank. So you have a sealed mask, you're exercising, and you're breathing 90% oxygen, right? So then all of a sudden, after a little bit of time, we monitor with a pulse oximeter. So we have an idea kind of where your overall blood, the blood flowing through your finger is in terms of percentage oxygen, which we want that to be 97 to 100%. So as you start exercising with this high level oxygen, so instead of 21% like you normally go to the gym without a mask, we're exercising with 90% plus 90 plus percent oxygen, and with the sealed mask. And then as we go through a little bit, we'll actually shift it to 14%.
Wow.
Because they have two bags. There's one with 90 plus, and then the other one has 14. So when you shift it to 14, the body starts kind of starving of oxygen a little bit. It's very similar to like going to a higher altitude with lower oxygen. So you kind of starving the body a little bit, and we'll see the pulse ox thing start to dip a little bit, and it'll start to go down, let's say to 90%. Then we flip it back to the 90 plus percent oxygen. When you flip it back, those starving cells of oxygen, the vasodilation happens and they get a ton of oxygen there. So it creates this like starving effect so that the cells can actually uptake oxygen quicker.
That is amazing. What makes LiveO2 different than the other oxygen therapies?
Exactly what I just talked about. It's really that starving effect.
Yeah.
And that starving effect kind of, there's actually people doing this therapy where they get their nervous system, their cells get so efficient with oxygen that they can literally exercise with 14% and their pulse ox never changes.
Wow.
Because their cells get so efficient. So it really, not only does it help to flood oxygen into the system and the cells suck it in, it also makes those cells work more efficiently at getting oxygen in the body.
Amazing. Why do you think that they're starting to use LiveO2 for performance and recovery?
Exactly for that reason.
Yeah.
Because number one, they're replenishing the number one ingredient in the human body. So when 65% of us, just scientifically, 65% of every person should be oxygen gas, and nobody knows that.
Yes.
It's crazy to me. But I've been doing this for so many years, and I have to teach people every day the number one ingredient is oxygen gas. So of course, if you're an athlete, especially you're somebody with any kind of health condition, you should be replenishing oxygen. You should be doing some type of oxygen therapy. Athletes love this in particular because it's quick. It's easy. They typically are already healthier. Their bodies are better oxygenated than average because they're already moving and grooving and exercising, right? So when you add this to it, it's a quick burst where it can just boost up those cells, and the cells just say, "Hey, I got my oxygen back, and I'm healing."
Yes. How does this also impact circulation and capillary growth?
Okay, exactly what I talked about. The
Okay.
average person, we have roughly 25% of our blood vessels are big,
Okay.
and then 75% are tiny. And so over time, what ends up happening is those blood vessels have a tough time circulating. So as the big blood vessels will pump blood to parts, and then you got to go through all those
Small
small
ones.
little capillaries and everything, and that's where all that circulation gets slowed a lot of times. And so it causes what's called vasodilation. So it literally opens up blood vessels in the body as you're doing this particular therapy.
That's amazing. How would this help somebody with chronic fatigue or also long COVID type symptoms?
Yeah, so it's really interesting with people with long COVID. Sometimes we'll put the mask on them with the 90+%, and we'll see their pulse ox dip.
Wow.
And it's because their body literally got so damaged with this particular virus that it has trouble understanding how to receive oxygen and take it in.
Yeah.
So we have to do special corrections to those people. A lot of those people require our quantum physics work with the nervous system, where we figure out what nerves are off and what cells are low in oxygen, and we have to reprogram them essentially. But we do this therapy in conjunction with those, and sometimes they're very challenging. But we've seen extraordinary results with so many people who have had long COVID symptoms. For those of people that don't know what long COVID is, it's like where you get a virus. And you should fully recover.
Yes.
You should be like, oh, I'm 100% after. But a lot of people get a virus and they're like, never
the
feel
same.
100% after, because that virus stays, portions of it stay active in your cells.
Yes.
And it just doesn't let up. And so we have ways of helping with that particular condition. And so many other conditions can be helped. Remember, oxygen, when you replenish oxygen in the body, it's the number one ingredient.
Yes.
So when you replenish it, everything in the body gets better.
Do you think that we're missing the idea that oxygen needs to be trained and not just delivered?
100%. Yes. It's it's such a different thing. You breathe maybe different than I breathe and somebody else. And maybe the time of the day you're breathing. What are you breathing indoors? Most people indoors 93% of their day. And then what are you breathing outside? What are you breathing on your way home? Is it some chemicals or toxins? So everybody's air supply is different, and that changes depending on what you're doing. Maybe you're traveling, doing whatever. It's dynamic. It's always changing.
Yes.
And so your cells, your body has to know how to uptake the number one ingredient as you're breathing. And if we're not breathing enough, or you're breathing bad quality air, of course you can have difficulties with this.
We talk a lot about the 7 pillars of health. Where does LiveO2 fit into this pillar?
It's in the first pillar, which is oxygen. And again, by far, it's number one because it's number one. Right?
Yes.
It's 65% of your mass of your atomic mass in your body is oxygen gas. So incredibly important for your overall health.
What is something that someone can start today that will help them improve their oxygen efficiency?
Breathe more.
Yeah.
Breathe more. People just don't breathe. And there's even better. Like, you could belly breathe. So when you breathe in, your diaphragm should expand. So your belly should go out when you breathe in. You shouldn't breathe so much from your chest, more from your diaphragm. So you breathe in, belly out, breathe back out, and belly in. So it's kind of like an inner tube expanding on your lower rib cage. Yeah. And if you just do several breaths like that throughout your day periodically, you'll notice a difference.
Amazing. Thank you very much, Dr. Cormier. That does conclude our talk today on LiveO2. If you want to give it a try, come to the Nerve Health Institute.
If this podcast spoke to you, or if you feel like you have family members or friends that have these types of conditions that could benefit from this particular technology, then all you need to do is become a bodychargers member or tell them about bodychargers. Remember, it's our community that I created to help people at home with the best technologies in the world to be able to help you to self-heal your body at home and maximize your self-healing. So go to bodychargers, become a member. That's the easiest way to get this done. And we look forward to serving you and your family. Also, if you want a higher level of care, we have the Nerve Health Institute you can always come to. That's our clinic where we have higher level services here to be able to help you. So I hope you enjoy, and we look forward to serving you and your family, and look forward to our next podcast.